Well, there are 19 million new cases of sexually transmitted diseases each year in the United States, which is hard to believe. And the month of April has been declared STD Awareness Month. Now, in San Francisco, syphilis is the STD that is growing out of control. There's a unique campaign in San Francisco called Dogs Are Talking, aimed at getting gay and bisexual men tested. With me now is Jackie McCright. She is a community-based STD services manager with the San Francisco Department of Public Health. And I just couldn't believe it when I read 19 million cases of STDs in the United States in 1 year. It just sounds like incredible. So this is what you work with, I guess. It's not a surprise.
No, it's not a surprise.
So in general terms, when we're talking about STDs, we're talking about all kinds of different sexually transmitted diseases. A lot of times I hear about STDs in the younger population, teenagers and early 20s. So are we talking about just like everybody or just a certain population in terms of age?
For the 19 million? For everybody.
For everybody.
But teens make up most of them. For chlamydia and gonorrhea are a problem with teens across the country.
You said gonorrhea. Now, when I was growing up, gonorrhea and syphilis were the two major STDs everybody's talking about. And it kind of almost disappeared off the radar for a while. But I guess it's making a comeback. And we're really here to talk about syphilis in San Francisco.
Right.
And right before we went on the air, I was asking you, I thought syphilis had kind of died off almost, and you said it did at one point in time.
It did.
So what happened?
We noticed the spike in 1999. We had 10 cases then, and then
10 cases of syphilis in the city?
In the city.
Wow, that's nothing.
And our job in the health department in STD control is to control, to keep STDs at a minimum. That's a major minimum, 10. But in 2000, we went up to like close to 500 cases, and that's a major increase.
In 1 year?
No, from...
No, you said 98 was 10 cases.
Yeah.
So in 2000...
Actually, in 1 year.
In 1 year?
Yes.
Wow.
So...
Any idea what happened, what the cause was?
Well, once syphilis gets into a certain group and a certain population, and if they're sexually active and have multiple partners, it can spread rapidly. And that's why we have to aggressively do something about it. And that's, one of the reasons why we decided to have a social marketing campaign to get the word out to. We found that it was only in this one population, primarily among gay and bisexual men. We knew that majority of the men were white. We knew that at least 60% of the cases, they were HIV positive. So we knew who we were dealing with, and we had to get the word out. And we've been consistently doing that so far. Now,
if in the year 2000 you have 500 cases, now in 2008?
Right, in 2007 it was pretty steady. So we had about 355 cases, so it's dropping.
Okay, so it's dropping. And it's because of education?
It is because of education, of getting tested. That's the only way that you can detect that you have it.
How easy or how difficult is it to be tested?
It's very easy to get tested. You just need to get your blood drawn, 1 tube of blood.
So it's a blood test?
It's a blood test. And it's very easy to get rid of. It's just a shot of penicillin.
That's it?
That's it.
So why are we not being able to control the syphilis cases in the gay and bisexual population down to where it was, like 10 cases a year?
Well, everyone's not getting tested, and that's the only way to detect that you have it.
Okay, very quickly, are there major signs that one can tell if you have syphilis that would call attention to it?
Well, the first sign is a sore. The sore is painless, and that's why sometimes it goes ignored.
Okay, and I understand that can heal by itself, or it looks like it goes away and you're perfectly fine.
Goes away, and then the next stage of syphilis has 3 stages, and then there's no symptoms, and then the next stage is a rash, flu-like symptoms, hair loss. And those are things that commonly can happen anyway.
Right.
So that might get ignored as well. Different things can cause a rash. The flu season, everybody has the flu.
Right.
And then that goes away. So then there's this whole long period where there's no symptoms at all. And that's why syphilis, can go for a long period of time. So by the time you go to the doctor, when you have syphilis, you've had it already for at least 3 months when the sore comes.
Okay. Now, if it doesn't get treated, and 6 months, a year later, and is it still okay to get a shot of penicillin and have it cleared up?
Yes.
Really? So
it's easy to get rid of. It's very easy to get rid of.
This is a really cute little bag, and this is a great bag for shopping, but this is Dogs Are Talking, and this is a Dogs Are Talking campaign that you have. Why Dogs Are Talking? Explain that a little bit. It's really cute. What's the idea?
We partnered with Promotions West, who's our agency that we're working with to do the social marketing campaign. And dogs haven't been used in relationship to health for marketing. And this is the first campaign that uses dogs as spokesmodels to get the word out to men.
And the idea is that dogs are talking among themselves, and we have a little poster here, that dogs are talking among themselves saying that your owners should be tested or something?
Well, dogs see everything that,
that's
their
right.
companions do. And so dogs, their owners care so much about them, and they care so much about their owners that they want them to stay healthy so they can continue taking good care of them.
Very good. And can you just go to the public health department and just go to your own private physician and get a penicillin shot, and it's simple as that?
It's as simple as that.
Now, I know that the department, and you've been very busy with free testing, there's a couple of spots tomorrow, Sunday, April 27th, where you can, that you're providing free testing, free STD testing. So people should really take advantage of that.
Definitely.
I mean, you make it sound like it's so easy.
It is.
So people have to take advantage of it.
Everybody doesn't like to get their blood drawn. That's
true.
not a fun thing.
That's
but
true.
It's not that difficult. And you get a good phlebotomist, it's no problem.
That's what she says. Thank you very much, Jackie, for helping us understand what's going on and to encourage people that this is a campaign because it's STD month, but really it's going on all year that you're really trying to educate people about this. So we have some phone numbers and website and information up on the screen in just a second, as well as the information will be on our website later on. So it's time for a short break. When we come back, cute kittens and a rescue dog. What they have in common is that they both need a good home. Don't go away. We'll be right back.